Let us pray. O Lord our God, in whom we put our trust, no other help we have but thee. We just want to take this opportunity and thank you for how you have watched over and cared for us through last night's slumber and sleep. You have allowed us to go through this day without any hurt and harm or danger thus far. We just want to thank you, Lord, for how you have given us strength. You put food on our table, clothes on our back, a roof over our head. You give us transportation. All those things that sometimes we take for granted. We want to thank you, Lord, for Church of God here in Williamsburg. We thank you, Lord, for each and one that have pressed their way out. We thank you, Lord, for all things. Thank you, Lord, for the slogan of church: obedience, love, reverence, and respect. First to God, then the leadership, then the one towards another. Thank you, Lord, for all things. Ask you those who are pressing their way here, ask you, Lord, to put an arm of protection around them and bring them here safely so they can receive whatever is need to be received for tonight. As you remember this service, whatever said or done, something help occur along the way. Remember those who are sick and afflicted, feed, mind, poor, and the blind. Remember those who are less fortunate than we are. Remember those who are suffering from a love, one that has passed on. As you remember them also in this today. As you remember this service, whatever said or done, help occur along the way. Your best ask in Jesus' name. Amen.
So good. Thank you. Brother, sister, I won't take it back. Truly, we want to thank God for all things, great and small. Thank God for his love that he showed unto us this day. granting us the opportunity to be alive and well, and being able to enter once again into this house to give God the honor and the praise, and for his blessings, great and small. Thank God for the scroll which reads obedience, love, reverence, and respect, first to God, then to leadership, and then to one another. Thank God for the principles and the teachings and the doctrines of Christ. Thank God for this being another Friday, fifth Friday. Work, health, night. Thank God for having Dr. Lara Quinn, long time knowing soccer player, and at William and Mary, and then when they got married, they wanted me to do the wedding. So we did the wedding. And one of the high points was when it was pouring down raining. And I said, thank God for the liquid sunshine. And everybody got a bright spot out of that, Judge. They say you have to learn how to make juice out of lemons. So it's always left up to someone when it comes to weddings and things that will brighten things up a bit. So God gave that to me at the time that he gave it. And it was rainy. So she is now a doctor. So we introduce unto you tonight. I asked her to come. She was delighted to do so. We'll do so. So without further ado, I'm going to mic her. Let her speak the mic. I'm going to ask you all to welcome Dr. Lara Quinn.
Like that.
Thank you.
So can you guys hear me?
Yes.
Yes.
Okay,
Thank you.
awesome. Just tell me if you can't for any reason. Do what I can. So as Howard said, thank you for the wonderful introduction. I'm Dr. Lara Quinlan. Howard did marry my husband and I about 14 and a half years ago now. So, and I got to know Howard when I was a soccer player at William and Mary, and he and his son actually drove our bus and did little services on soccer trips for us and everything else. So it was pretty special time, special man, special relationship that we've had over the years. So as he said, I'm now a doctor, and he asked me to come and speak with you guys tonight. I really wanted this to be kind of informal, and so feel free, I'll talk just a little bit about what I do and then open it up to questions from you guys, because the whole point, I think, is health and wellness and how that relates to what I do. So I am a family practice doctor trained in sports medicine. So what that is that I did all of my schooling, and then I did my residency in family medicine, so a family doc, and then I went on to do extra training in sports medicine. Sports medicine isn't just sports, it's all non-operative orthopedic issues. So I do a lot with not only sports injuries. I'm in my sports gear right now because this is what I wear when I go out to cover community games. I work with William and Mary up the street. I work with the the Newport News schools down in Newport News, the city schools, all 5 of them. I'm their medical director. So I do a lot of stuff with the community. I cover a lot of events. I don't know, you guys familiar with Todd Stadium down there at all? It's been there for a little while, right? And then, all over the place up here with William and Mary and some of the high schools. And so I cover events. I also work in the office, and I do all sorts of things like injections, and I take care of things like arthritis. I really take care of the entire body, all joints, muscle issues, that type of thing. But in addition to that, I also do a lot of counseling on exercise and how to lead healthy lifestyles. And my practice has a physical therapy practice that we work with. And we partner with one of our divisions called Strive, which is basically a healthy living offshoot of physical therapy, where they do a lot of exercise training, specializing in people who have had injuries or other issues with their body and need some special exercise plans and things like that. So we do a lot, and I personally do a lot with helping people be healthy and stay healthy and use exercise as a way to, I don't know, make their lives better and not just lose weight, but just be healthier at whatever weight you are and just be happier. It's called, a few years ago, there was a big push towards this movement called exercise is medicine, and it was geared towards my specialty and what I do. So there's that. Some of the things that are in the news that you would have seen lately are all of the stem cell stuff. I don't know if you guys have heard of any of that, but so I do all of those types of injections and things as well. And so I have people come and ask me about those things in addition to, regular cortisone injections and stuff like that. So trying to think, any things like simple broken bones, do casting, splinting, some problems like carpal tunnel, tennis elbow, like a whole bunch of different problems with tendons and like I said before, also arthritis and stuff like that. I do all of that stuff. And so try to wrap it up into a healthier way to live your life and deal with whatever injury or issue you have, be it acute that's going to get better or chronic that we can get better but may not be perfect and that you'll have to live with, but how to manage it. So those are things that I help people focus on. Yeah. Question?
Arthritis.
I did.
Do you have any recommendations on how to prevent even getting to that point?
So
Or
how
is it mainly something that is just treatable?
So the question is, how do we prevent arthritis, and is that possible? So the answer is, it's partially possible. Arthritis has several components to it. One is mechanical trauma on our joints, meaning like what you do in life and our weight and our lifestyle choices and things like that. So for instance, someone who, I see a lot of workers at the shipyard who are up and down on their knees all the time. They tend to get more arthritis than someone who sits at a desk job for 50 years, However, they also tend to be more active and don't weigh as much as sometimes as people who have been not active for their life. So you can partially prevent arthritis by being a healthy weight and by exercising. But arthritis is not completely preventable. So if you get arthritis, it's not your fault. You can blame mom and dad for it if you want to, because a lot of it is genetic. So I work with people to manage the arthritis that they have and try to prevent it from getting worse by keeping people healthy. There have been a lot of studies that have showed that arthritis is, the pain from arthritis is reduced by exercise. So I help people find the right type of exercise for arthritis. So walking is great. I love it. It's a wonderful cardiovascular activity and it gets you really healthy and gets your heart good, right? Wonderful. But if you have a terribly arthritic knee or hip, you may not be able to walk for long distances without being in significant pain. So that's not the right type of exercise for you. Maybe you learn to bike or walk in a pool or swim or do yoga or something new that's all the rage these days called chair yoga. So all of those things are things that you can do, and you have to find what's right for you because that's how you'll be motivated to do it. And I don't want you doing something just because I tell you. I want you doing it because you enjoy it and it helps your life.
Wonderful. Thank you.
Thank you.
So I'm just trying to think. Any other questions that come to mind about specific issues or?
Stem cells, you spoke about the stem cells. What's the benefit of stem cells? What is it?
So there's a whole, area of medicine now called regenerative medicine, and stem cells are part of that area. So they're typically injections, and there are regenerative injections, multiple types. The ones that I do, the first ones that came out probably about 15 years ago were called PRP, platelet-rich plasma, and that's where we draw your blood, we spin it down, and we get what's called the platelet-rich plasma layer of blood that has growth factors and healing factors in it. And it's typically used for chronic tendon problems, partial tears, or muscle tears. So I use it a lot in people with partial rotator cuff tears in their shoulder. I use it for people with tennis elbow. I use it for people with Achilles problems. And it's a very good option to try to avoid surgery. There's also something called amniotic tissue and matrix. And I'm not talking about ethical issues or anything, But amniotic tissue and matrix, what it is moms who have had C-sections have voluntarily donated fluid and tissue from like the placenta and stuff, and they use that because it's very potent growth factors and healing factors. And it's all been screened and everything like that, and that is injected as well to help things heal. Stem cells are the final tier. It kind of goes in tiers. And stem cells are cells that are in our bodies, typically in our bone marrow, where they're the most concentrated, that you can harvest and spin down. And so you get these cells that don't know what kind of cells they're going to be yet. And so those stem cells, whatever tissue they're injected into, they become that type of tissue. And so they are very potent, potently able to, for instance, the most common use of them is to help try to regrow cartilage.
So they are neutral?
So they are.
You say they haven't figured out what
they're very powerful cells. All they need is something around them telling them what they need to be. So what we basically do is you have to undergo a procedure that we put a needle into your hip right here and pull out bone marrow. And then in that bone marrow is a bunch of stem cells. And so those stem cells then get injected, for instance, most commonly into maybe like your knee, a knee that has moderate arthritis. And there have been studies that have shown it can actually help regrow cartilage. So
they're just hanging loose in the marrow?
They're just in they're in our bone marrow. There's some in like our fat cells. There's some in like different tissues in our body, but the most concentrated area of them is our bone marrow.
And they're very powerful cells.
Mm-hmm. They're very powerful, and they have very powerful healing capabilities. So they're not right for every type of injury, but they're used mostly with degenerative arthritis type stuff. The only thing I caution people against is that all of the regenerative injections are expensive because insurance as of now doesn't cover them. So I always tell people that they're out there and that they, whether or not your particular issue is a candidate for them, but it's always a discussion as to whether or not that's the right treatment for you based on what your injury is or what your issue is and, monetarily, if that's the right thing for you, because they can be wonderful and they can work really well. And I've seen them work great, but it's not a guarantee, 100% guarantee. So they're really, really cool things that we do. So that's another area of medicine that I kind of delve into and that I do as well.
Another question.
Mm-hmm.
I had a friend that told me some years ago that he had lost a disc in the back or had to replace a disc. Mm-hmm. And his, like you were saying, lifestyle, he's a drummer in his church, mm-hmm. and he has to stand up all the time to play percussion instruments. Mm-hmm. And I'm thinking that it has something to do with that he's always on his feet for long periods of time.
I mean, maybe. There's no way to really tell if that had anything to do with him getting the disc replaced or not. It could have been that he twisted wrong doing something one day, or that he was in a car accident one year or something like that. So I have no way of knowing if that's how he did it. As far as what could he do to make playing the drums easier for him and more fun for him is probably to do some exercises to work on core strengthening that would help him be able to maintain that position for longer. Or he could also find maybe a tall stool that he could take some breaks on and things like that to take some pressure off his back. So little things like that. I talk a lot with people about ergonomic adjustments to the workplace. You guys ever heard about like ergonomic things? Yes, no, maybe. Okay. So like ergonomic adjustments, like certain types of keyboards or pads that you can rest your hand on, or different types of mouse pads. Those sit to stand desks. If any of you guys have like a desk job, the sit to stand desks so that you're not constantly in one position and you can adjust your position have shown to be helpful for people. Yeah.
I've heard people talk about discs in the back. Mm-hmm. What exactly is the disc in the back?
The disc in the back. So are you guys familiar with what a vertebrae is? So the vertebrae are the bones that make up our spine and our back. So the discs are the little soft cushions in between them, in between the vertebrae. And they kind of look like a jelly donut. So if you can picture like a little donut, literally, with like kind of harder around the outside and then like jelly around the middle. Come on, who likes jelly donuts? Yeah. So a disc is like that. It's a cushion in between the vertebrae.
The cushion.
Mm-hmm. It's the cushion. And when they get herniated, the jelly pops out. That's what happens. Mhm.
That's when it becomes painful.
Yeah, that's painful because the jelly irritates the nerves around it, around the discs that are running right there by the discs. And so that's called a herniated disc. Typically, if it's not too bad, you can get it to heal somewhat and may not be a
Stem cell?
no, well, maybe, but no, typically they will heal on their own if you just give them a little bit of anti-inflammatories and some rest and then, some strengthening therapy for the core. Typically they'll heal within about 6 weeks or so. If it's a really bad one, sometimes it pinches a nerve and you can lose feeling or something like that. Then it's a little more urgent and you need to make sure that you're getting treated actively because we don't want you losing strength in your leg or anything like that. But yeah, I mean, getting treatment for them is a good thing, but typically small disc herniations will heal in about 6 to 8 weeks or so. Mm-hmm. Mm-hmm. So core strengthening. So what can we do for core strengthening is the question. So that's a really good question because it's really important for all ages. So when we're young, so there's a couple things. So when we're younger, when we get to elementary school or even like middle school, I actually recommend, and there's been a bunch of studies that have shown that doing multiple different sports and things like that are good. I'm talking about the younger population for a minute, and then we'll talk about some more stuff. And then starting to do things like actually a little bit of like weightlifting and that type of stuff. I'm not talking about crazy heavy bench press or whatever. I'm talking about like gentle, like proper form, lightweight lifting, and learning how to do that can be really good for you. As we get older, doing some resistance training as well. So again, you don't have to be going to do like heavy, I'm going to go to the Olympics, weightlifting, okay? But doing a little bit of like resistance with bands or very light weights and things like that is very good for you. Specifically for the core, things like planks, crunches, if you can tolerate them, if they're okay with your body and things like that, are really good for you. Swimming helps build core strength. Yoga helps build core strength. And there's lots of different types of exercises. You'll probably see like the little ab things, the ones where you at the gym where you go like obliques, where you have to twist. That's the oblique muscles in here, okay? And then the back. There's some simple ones you can do just like literally on the floor or on a bed or on a bench, that type of thing. We have a whole slew of exercises in our electronic medical record that we print out for people and hand you to go home with so that you can see some in a picture and just copy them and do them at home. A lot of them are available online. You can literally type into Google like core strengthening exercises and you'll probably get a whole bunch. Look for like a physical therapy site that pops up and they'll have like exercises for core strengthening.
Great.
Yeah, maybe. I mean, it depends on how much money we pay Google.
Okay.
But the stability balls or the Bosu balls are good for you too. Like there's exercises you can do on them to work on your core and all of that stuff. So does that answer some of your question?
Great.
Thinking Keith called in and he wanted to know what kind of ergonomic do you advise for a bus drive?
Oh, that's a good question. So for bus driving, I would recommend probably a lumbar support cushion or a proper seat that can be, inflated or adjusted for your back to make sure you have proper support if you're sitting in a bus driving for a long time. Likewise, if you're sitting in a chair, have a job where you're driving for a long time. They do make actually like inserts that you can put on top of a seat. So I have a couple of patients who are like UPS drivers and they don't have a choice as to what trucks they drive. So not as nice as your buses, but the trucks have really bad seats. And so they've actually gone out and gotten like a lumbar support like seat that you basically set on top of the seat. It's almost like a little child like booster seat, but for an adult that has proper support and it helps.
Lumbar specifically, what can you describe lumbar? Is it something that supports the back, pushes? Is it like a rounding out?
Yeah, it's one of those cushions that kind of looks like a cushion that has like a little like rounding in it, kind of that fits within the back.
Your vertebrae.
It's targeting your back to give it proper support. That's one thing.
Anything like that?
So that's just going to be for you to sit on. That's just going to be something to sit, so something to cushion, which can be helpful if you have something that's like if you, I don't know, I have some patients who are out on tractors all the time. So obviously they don't have like a big seat to put anything in. So just putting a little cushion there can help with some of the vibration and impact to their spine. Or I have some forklift drivers and they'll just put a little cushion on their seat to help, minimize impact. The other thing I would say for bus drivers, like, because they have to hold the wheel all the time, is just to do some carpal tunnel stretches and exercises, and potentially even have some carpal tunnel braces or some padded gloves that you can use when you need them.
So you said they're printouts of these exercises.
Yeah, if you Googled carpal tunnel exercises, yeah, and I see people with carpal tunnel syndrome and give them exercises and things like that. Mm-hmm. So, and then I would just say, I don't know, I'm thinking bus driving, so anything like if they have to have their neck in a certain position for a lot of times, then, doing some preventative neck stretches and things like that before or during like long drives is probably going to be a good thing for them.
Have you found those lumbar supports to be pretty expensive, or it's like a range?
I have to be honest, like I don't have them personally in my office. I don't know of any offices that really keep them in the office. However, typically I'll either have people go to a medical supply company, or nowadays they honestly either just get them on Amazon or Google. So, and they'll just, sometimes people will bring me pictures of one and say, hey, do you think that looks pretty good? And I'm like, yeah. So they really are variable as far as the cost. So it just depends. Some of them are like electronic and adjustable and everything else, and some of them are just a simple little cushion. So, yeah. Stretching. Stretching of their back and their legs, like before and after drives, making sure they take adequate breaks when they can and things like that.
And what about?
And then staying well hydrated. That's always, that's something that kind of goes along with cramps in general.
What about seat positioning? Like you don't want the knees to be so far up.
Yeah, you want to be in like a neutral. You want to be in a neutral position where you're at like 90-90. So that means your knees are 90 degrees and your hips are 90 degrees. So that's typically like a good position. I talk with people about fitting them for bikes and things like that too. There's several bike shops in the area. And people with a lot of back issues, I typically recommend like a recumbent bicycle. Have you guys ever seen those? They're like the tricycles. They're like the ones that, they're like the 3 wheels, and people are almost like laying down in them and they pedal like this and they have the hand controls here. So they're pretty cool. But I know they sell them around here at the bike shops. And then there's also like stationary recumbent bicycles where you kind of sit in the chair and pedal. So there's a lot of different ways that exercise equipment has evolved to help people who have different medical issues. And so I encourage people to access those, because not only do you get things brand new in stores or on Amazon, but you can also get things now on Craigslist, like on Williamsburg Trash and Treasure. I don't know if you guys have ever heard of that site. You can go online. There's a lot of like trade sites or like, consignment type stores and things like that online too, that you can get different things. So.
Proper ways of riding a bike, because I've heard of it. I've heard of back injuries related to, being on, people that do spin class.
So question is about back injuries of people riding bikes. I see a bunch of young ones here. Who rides bikes? Yeah? Cool.
We have one that rides bikes.
Yes,
Awesome. Awesome. So, the thing with bike riding, we see some like nerve issues in the elbows. You can see some back and neck issues because of the posture that people have when they're riding now I'm talking about a road bike, speed bike. So I often will tell people, we talk about core strengthening, core stretching, and adequate warm up and cool down when they're getting on and off the bike. But then we also talk about, varying their training a little bit, doing some training on like a mountain bike, making sure that when you're fit for your bike, that when you're pedaling, that your knees are not coming up so high, or that you're not always reaching for the pedals. Because both of those things, if the pedals or the seat are set too high or too low, then you're not in like a natural position and you're going to have deficiencies. So also strengthening your upper body and your core, in addition to the fact because your legs get a lot of the exercise when you're riding a bike. Huh. So this has been a big push over the last 5 years in sports medicine that we've found that actually, so all you girls out there who are thinking about playing sports or who have played sports, so I don't know if you guys have ever heard of girls, we tear our ACLs more often than boys, okay? A lot of that is because our core strength, we think, is because our core strength is not as good. But there's been a bunch of research that showed that core strengthening can prevent knee injuries. There's actually exercises out there now for soccer players to help prevent ACL tears. And there's been just a bunch of research and data that has showed that core strengthening helps with knees, ankles, hips, and everything, especially for runners and stuff like that. So yeah, absolutely.
I got a little problem with just started drinking in the last month or so, right? And I only noticed this during one thing that I do. It's brushing my teeth. I brush my teeth and I go to the toothbrush. So now I'm starting to brush out that.
Uncomfortable where?
Right in this area.
Oh, you probably have arthritis in your thumb.
But that's it.
All right.
Do you text?
Oh, come on now.
Yes, he did.
Come on now.
What kind of work do you do? What kind of work do you do?
That's, I work on
Typing.
computer and
Come on
I
now.
call, I teach class.
Are you right-handed?
Yes, I'm right.
So, I mean, I don't know for sure, but it sounds like it might be just, if it's right down in this area, the very classic area for arthritis in the thumb, right down in there. Or, I mean, there are a couple like nerves that run right through here too, so it could be that you're just irritated in there for one reason or another, or if you're getting numbness and tingling, it could be carpal tunnel. But right in here, if it's just like thumb type stuff with gripping, it may be arthritis. You can grip differently. You can do, sometimes I recommend sleeping just with like a brace over the thumb, just at nighttime. You don't need to wear it like all day or anything like that. And then you can also do like a little bit of lidocaine or biofreeze, just like rubs right in there. Just get like a little grip ball. Just work on your grip to kind of work it out a little bit.
Does water help with that? Drinking water?
What?
Hydrated? Does drinking water, staying hydrated help with that at all?
Staying hydrated helps your body replenish its cells, helps it recover from exercise and any like insult that occurs to the body. So it helps flush toxins and everything like that. I'm not talking about crazy detoxifying like 10-day regimens or whatever. I just mean good hydration and normal water. I'm a big fan of simple stuff, not crazy fads and things like that, but just simple, healthy living.
He had asked, what can he do? What about instead of, like you, because you immediately thought, or you asked him, does he text often? Can you start going to the swipe way of?
Yeah, I mean, you could do all sorts of stuff to try to avoid like those tiny little gripping movements or tiny little movements. Yeah, there's like a whole new diagnoses of like literally there's like texting neck because people text like this all the time and they hold their neck this way. So we actually have to like treat people sometimes for like, I see people with thumb issues and carpal tunnel from gaming. So like, so I have to treat them. I mean, I've had some really serious gamers and they get really bad hand pain, but it's a big deal to them because that's what they do. So.
What about musicians such as those that play piano?
I mean, yeah, the carpal tunnel, like wrist and hand strengthening and stretching exercises for your wrists, hands, forearms, and that type of thing. Yeah, I mean, absolutely with piano. Anything that's like repetitive movements and things, you can be more susceptible to that. Trigger fingers sometimes and stuff like that, if you guys have ever heard of those. Yeah.
Arthritis in the knees.
Uh-huh.
But like on the side, like when you're
Mm-hmm.
doing this side of your knee, that kind of problem. Is that, how do you know when it's more serious than arthritis? from the pain.
So how do we know how serious the arthritis in the knees are, and what do we do about it? So the knees your knee has basically 3 different compartments: the medial, or the inside, the lateral, or the outside, and then what's called the patellofemoral, or like the front of the knee. Arthritis is the wear and tear of the cartilage that's around the bones, and then the meniscus that's in between the bones and the knee. So oftentimes, as the cartilage starts to wear down, you get tears in the meniscus. We don't recommend rushing off to surgery for these things typically, unless it gets bad. How do you know if it's bad? Well, if you start getting your knees getting swollen over and over again and you can't get them to stay down, if you have constant pain that's altering the way that you walk or live your daily life, those are indicators that it's bad. If you notice that your legs are changing shape, and usually it's like bow-legged, you look bow-legged, or knock-kneed, either one. If that's getting worse, then you have an idea that arthritis is getting worse. If you can't fully bend or extend your knees, that could indicate swelling, or it could indicate bone changes in there. So those are all reasons to maybe seek some additional attention, especially if it's giving you a lot of pain and discomfort, to know that it's getting bad, so to speak. But it really, arthritis, we don't treat x-rays, okay? So no matter what we do, is like if we x-ray your knees and that type of thing and we see something, it's still not gonna make me know what to do right away until I figure out how your arthritis is affecting you. So we treat the patient, not the x-ray. So it depends on what symptoms you're having, not just how your x-rays look. Because I've seen people who are almost bone on bone who really get along fine and still have pretty normal alignment and aren't in a lot of pain. So we do an injection maybe once a year and they're okay. But there are other people who seemingly on x-rays have way less arthritis, but can barely move, can barely walk. So what I generally tell people who come into me about knee arthritis is that there are, options. If you have really bad knee arthritis and it's so bad that it's running your life, go get your knee replaced, okay? But if it's anything short of that, or if you're not a good candidate for a knee replacement or don't want a knee replacement, then we can manage it non-operatively. And the way that we do that is with exercise. Okay, we come back to that again, right? So the right type of exercise, and I say low impact activity. Some of the things we've already talked about. So exercise, braces. I have some braces like that I give at my office, and then there's also some available like over the counter for knee arthritis that I tell people to wear when they're up and about or having to do activities that would normally cause them pain. I don't give people braces to use all the time. So I tell people to use the braces, use them as a tool, not a crutch. Does that make sense? So you're going to use them when you need them for activities, but not all the time. So exercise, brace, medicines. So medicines like ibuprofen and Aleve are meant for arthritis. They're anti-inflammatory medicines. They help with the pain of arthritis more than things like Tylenol. However, not everyone can take anti-inflammatory medicines, and no one should take them in high doses for long periods of time. So there have also been some studies that have showed that alternating Tylenol with ibuprofen or Aleve in the same day can help with pain more than just one or the other. So I'll tell people to take, a Tylenol in the morning, an Aleve at lunchtime, and a Tylenol at night. And so that'll help with their pain to keep them under the maximal dosing of medications and keep them safer as far as medicines go. So exercise, braces, medicines, and injections. So injections are the other way that I help people deal with arthritis when it's bad and when it's painful. And so there's different types of injections. We talked about the regenerative injections. Cortisone shots, are used, and they can be very good to help cut down on pain and inflammation when used appropriately. And then there's also another kind of shots. Have any of you guys heard of the gel shots for the knees? So there are shots out there called viscosupplementation that are gel shots, the thick gel substance that's meant to act as a kind of a motor oil lubricant or a cushion in the knee. And that gets injected into the knee, and it helps coat things and cushion to help with pain. So all of these shots can be used, appropriately to help manage knee arthritis.
So arthritis is a breakdown of the tissue.
The breakdown of the cartilage. Cartilage along the bone. So then you get bone spurs that grow, and then the joint will produce more fluid, and that's why it gets swollen and things like that. Yep, absolutely.
Can we talk a little bit about cramps?
Cramps? Yeah, so
Like, I wake up sometime in the middle of the night and I'm cramping.
well, cramps are a tough one, and not always in my purview, but I do talk with people about them because they can be. So the simplest explanation of cramps is that you're dehydrated, especially in the summer if you're getting them more. So drink more water. You can get cramps from overdoing it or underdoing it with exercise, and so stretching can be very helpful. So sometimes I tell people to stretch before they go to bed. Cramps can be caused by muscles, they can be caused by nerves, they can be caused by hydration status, they can be caused by like blood vessel issues, they can be caused by a lot of different things. Electrolyte imbalance, that type of thing. So who's heard of like eating bananas for cramps? Yeah. Okay. So bananas have potassium. That's what that whole thing is about. But eating a banana probably isn't going to do a whole lot for your leg cramps. Actually, more often it has to do with sodium. So,
Sodium?
yep, sodium.
Too much?
No, too little.
Too little?
So if you're having a lot of cramps, actually a little bit more salt is a good thing. But I will say, you know, it all depends. Like if you have terribly high blood pressure and stuff, obviously I'm not gonna recommend you go eat a lot of salt. But when my athletes get cramps, it's because they're dehydrated and they're out of balance with their electrolytes. And so they need to rehydrate and drink, and I tell them to go eat a salty meal.
That's that salt tablet, right?
Huh?
Is that the salt tablet?
Yeah, so those aren't absorbed as well as like regular salt from food. So I tell them to go eat salt. It's one of the few times you'll ever hear a doctor say that.
Yeah, I'm very surprised they have not.
We're talking about cramps, but at nighttime, sometimes also people get like night cramps. Sometimes it's like restless leg, like nerve related. There are medicines to treat that and stuff. It's simple things like stretching and drinking water and, you know, eating some potassium is a good thing. Potassium, magnesium, B complex vitamins, and vitamin D are good things for cramps.
Do you think that diabetes has anything to do with those? My husband suffered with those cramps, like
Diabetes can. Neuropathy.
And he has a banana every day and drinks a lot of water all day. But at night we get those trouble cramps. Sometimes it's in his calf, or sometimes it's in his arm. He'll get in his arm or his hand or something.
Yeah.
And
He may have some neuropathy. I mean, I don't know, but
he does.
yeah. So that's very common with neuropathy. There are actually medicines that we use for that specific purpose. Like Neurontin is a medicine that I use for it pretty routinely. But yeah, there are different medicines and things we can use too. So cramps are a big, broad topic.
Because sometimes it'll get into my hands and start twisting, and I have to straighten it out and shake it, and it'll go out.
You could have some carpal tunnel. You could have a little bit of carpal tunnel if it's getting into your hands a lot.
Because of doing what?
He's driving.
Driving, life. I mean, people get carpal tunnel. We don't always know what causes it.
Do you have recommendations on how he should drive? You know, if he's driving most of the day?
If you're driving most of the day, I mean, I would take some breaks and do some stretches. There's like the prayer stretch.
I'm holding the steering wheel a lot of times because
Very shaky probably too.
Yeah.
not necessarily the shaking, but the keeping the tractor in its mode that it's supposed to.
I would say some like neck stretches and like some carpal tunnel stretches.
Well, my VA doctor said I had some arthritis in the back part of my shoulder, between my neck and my shoulder. Because I used to carry M60 machine gun across the back.
That'll do it.
Will I do it?
Yeah.
Well,
I have a bunch of old flyers who used to jump out of planes all the time. They have spines that look like mush now.
Oh, wow. I can imagine.
Those discs that we talked about are all flat.
Lifestyle.
Yeah. So.
But speaking about the cramps that Sometimes it all depends on what I eat or what I don't eat.
Sometimes, yeah. Pay attention.
In the middle of the night, I have to jump up and stomp.
I mean, you might have some restless legs. It's kind of trial and error. Try the nutrition stuff first. Try the stuff you can control first. Try some stretches. Try to stay hydrated. Try to stop during your activity during the day and take some stretching breaks and things like that.
So that will follow you right on into night?
Oh yeah, I mean, at night, yeah, but at night everything gets stiff. So try some carpal tunnel braces at nighttime, okay? On the wrists, but if you're talking about in the legs.
Talking about right in the calf.
Yeah, I mean.
Sometimes in the bottom of the foot.
So
right in the curve.
Do some stretching. You can ice after you get done with a lot of activity if it's sore and that type of thing. But try the things you can control first. Try hydration. Try some of the electrolyte stuff. Try, drink some Gatorade after. I like the G2 because it doesn't have quite as much sugar. But, try drinking a Gatorade after instead of just straight water and that kind of thing. So do the things you can do first. Take a little B-complex vitamin and some vitamin D at night if you don't already take it.
I'm taking B12 right now.
Mm-hmm. So B6 and B2 are good for cramp type things as well. And so is
B6 and B2?
Mm-hmm. So is magnesium, and so is vitamin D. So, try those things. I'm not a big advocate of GNC's like 50 million vitamin pills per day or whatever. That's not what I'm saying. But, if you're having these specific issues, try some magnesium, B-complex, and vitamin D. Drink, make sure, try some Gatorade and, try some stretching. Do those things first to see if you can kind of help yourself. And if things are still happening, then is it bad enough that you want to consider things like medicine or like doing some physical therapy or getting a test of the nerves or something like that? And that would be something to talk with someone like me or your family doc about.
So vitamin D is, what happened to my vitamin D? No, D.
D.
I ran out of the D.
Question about D. I thought we absorbed a lot of vitamin D from the sun.
You do. However, so for different reasons, so because we wear so much sunblock now, often people are vitamin D deficient. And also, if your skin is darker, you typically don't absorb as much vitamin D.
Oh, really? Mm-hmm. I didn't know that.
So the melatonin, the melanin in our skin, like it blocks a lot of the harmful things from the sun, but also.
He's out in the sun, I think, a lot.
Yeah.
So he's probably not absorbing vitamin D.
Well, I mean.
I'm inside air conditioning. The tractor.
So, I mean, there's a lot of different reasons, but.
Sun rays.
Well, and cramping, so the other thing with cramping too, and I talk about this with my athletes all the time because I do pre-participation exams for all the like middle school and high school kids. So is sickle cell trait. Like, have you guys ever heard of that before? No. Sickle cell trait. So sickle cell disease was something that evolved, centuries ago to protect people against malaria. So it evolved typically over in like the Middle East and Africa, where there were a lot of mosquitoes and a lot of malaria. So sickle cell is protective for malaria, but it's not protective for like sickle cell disease is when your blood cells change shape in response to stress. And that can be heat, that can be mechanical stress and that type of thing. So it's not good for you. So sickle cell disease can be crippling for people, but sickle cell trait can be protective for people. And that's why it evolved in the first place. But sickle cell trait is more common in people of African descent or Middle Eastern descent.
Right.
And it typically runs in families. And if people do have sickle cell trait, they can still do anything they want to in life, especially with athletics and things like that. However, I counsel them on hydration and and nutrition because it's extra important. Because if they start cramping, they have to stop and they have to go and hydrate themselves. And they're the ones who sometimes end up with the whole body cramps that we have to send for IVs and stuff like that. So sickle cell trait is another thing, but I mean, that's something you can't do anything about other than making sure you stay really well hydrated.
You're constantly speaking about hydration. My daughter's all.
Well, it's summer, we think about that all the time in sports medicine right now.
My My daughter-in-law, who's a high-end nurse, she's always sending messages. Make sure you be high.
See?
Make sure. And it's, Gatorade is not it all the time. It's water. And so,
Now we're hearing something about alkaline water. There's a movement out there about alkaline water,
Yeah,
high pH.
sure,
pH
whatever.
10, 9. What's your recommendations?
I mean, it gets neutralized in our stomachs. We have so much stomach acid. So, I mean,
Are you saying that it doesn't matter?
no, of course I'm not saying that. Yeah, I mean, I'm very skeptical of most of the fad diets and fad everythings. You know, I mean, over time, it's been shown that, you know, the simple food ingredients, kind of like the paleo style diets and things like that, that are, you know, moderated in the carbs and things and stuff, are better for us. But like Atkins, who, you know, the whole world thought he had solved the riddle for a long time, died of a heart attack and the whole 9 yards. So, I mean, there's not one specific diet or like drinking fad that I typically support. It's really all about, and I do work with like a nutritionist and stuff like that too. I mean, not me personally, but like in my practice, I work with a nutritionist that I refer people to if they have very specific questions as to what's right for them and what they should be eating and doing with diet. And so I will defer to her as far as like those very specifics. The alkaline stuff, I mean, truthfully, our stomach has so much acid in it, like it's going to neutralize just about whatever you drink, but it's not actually good. Like people used to take Pepto-Bismol for everything, or do like the activated charcoal and all that stuff for things like poison that they would drink. We don't do that as much anymore because we found out it was like messing with our stomachs and like the pH balance. So anything that's going to mess with that, I'm not like a super big fan of. But
what milligram of vitamin D?
I take 2,000 to 4,000 a night.
So 1,000 is not doing me any good.
And it keeps, and I check my vitamin D levels, you know, sporadically, but it keeps me.
Is that?
1,000 probably isn't enough. If you're low, 1,000 is probably
not.
not.
That horse pills he had was choking me. I wasn't gonna take that.
The ones that I take are maybe like that big.
Yes, that's what I'm.
The little pearls. I get them at
I
Target.
have the 1,000.
I get the 2,000 milligram,
But I
the
only took it
2,000
once
unit
a
one.
day. I take
You definitely want to do vitamin D3, not vitamin D2.
Vitamin what?
D3.
D3.
D3, yeah, that's my.
It's absorbed better than D2.
Vitamin D3.
Gonna go back, Vic and Keith called in again, and he said, does cracking your knuckles cause arthritis?
So no, that's never been proven.
Because he does that a lot.
Yeah, I crack. Yeah.
It's the same thing about people talking about chewing ice. I've been chewing ice all my life.
Oh, thank you.
Sometimes chewing ice can be a sign of iron deficiency.
Well, that's what my sister-in-law in DC says, but
I mean, I don't know. I haven't seen blood work.
they said that she was anemic.
Or it could just mean that you like to chew ice.
I love chewing ice. It's my water.
Not enough water though. Uh-huh.
I know a lot about it. I actually had cramps in the right pad,
Mm-hmm.
and I want to take a knife. But
If they're cramps like when you're walking or cramps at night?
I can get down while I'm sleeping.
Yeah, okay.
I got down, then I put back.
Mm-hmm.
Down next week.
Yeah, I love John. He's great.
And side.
Uh-huh. It could be causing the cramps if it's in the same leg.
Had me stand on this thing. Back.
Yeah, calf stretching.
So I have one thing.
Uh-huh. Yeah, the little rolly thing.
I put it
Yeah.
against the wall, I stand for 5 minutes.
Yeah, you can get like a like I was saying with the stretching,
Should
you
I do
can
that at night?
a stretching. I just said the stretch. Yes. You can get a little thing that you can do similar to that.
Shake like this. I just put a hole in there, top one,
Yeah.
and I put my feet, I stand against the wall,
Yeah.
and I stand for 5 minutes.
Yeah. You can get like a triangle, like wedge-shaped piece of wood, put it up against the wall, and just stand on it.
Right.
But if you're so tired when you get home, you don't have time to stand there.
Well, I can't solve all your life problems. Isn't that your job? Aren't you supposed to do that for me? Or no, he's supposed to do that, right? No, I'm just kidding. We're supposed to solve our own problems, but yeah, I mean, doing the stretching may help you at night. Absolutely, and you're right, those the little rocky ones are
It
good.
doesn't happen all the time.
Tell John I said hi.
I will. I haven't seen him in a couple of years, but I've seen him in passing.
He's a good guy. I saw him a couple weeks ago. So yeah,
You know what we talked about, okay?
yeah, physical therapy. I work real closely with physical therapy, and I highly recommend physical therapy for the majority of things that are wrong with people. I mean, there are definitely things we need to actively treat, like rest or put in a cast or do injections on and things like that. But physical therapy, in my opinion, is like 90% of the answer, about 90% of the time.
That time, going to like twice a week.
Mhm.
And the last thing.
Yep. Good. That's awesome. The traction. Yeah, it helps relieve pressure on the nerves. Traction helps relieve pressure on nerves in the back and neck. Something like that. Kind of like it's almost, if you have never done it traction before, it's almost like a medieval torture device. They like they stretch you, literally. Yeah, it's pretty funny. Yeah.
Erica had wanted me to ask you, that one of her friends broke her arm, she fell off the floor.
Yep. That'll do it.
Well, what happened? Well,
So while the cast is on, the bone heals. So did your friend have a cast? Did you get to sign it? You had a cast? Yeah, so while you're in the cast, where the break is in the bone, it heals. It grows back together. And the cast just lets it grow back together so that it still looks like a regular arm and isn't all funny shaped or anything. Is that cool?
I told her she said that she would ask her. I'm trying to tell her that she should be done.
My little boy had a cast in last fall. It wasn't very much fun. He had to have it for Thanksgiving. It wasn't very much fun. Cast can look pretty cool, but it means that you have a broken bone underneath. That was a good question. Cool. So gymnasts are really prone to back injuries and to ankle injuries and wrist injuries. So what you can do early on is just make sure that you're not only training gymnastics, that you're doing some cross training with, again, you're going to hear me say this a million times, but with the core strengthening, like your abs and your back and stuff, and make sure that all of the activities you're doing aren't arching over and over again. And you want to make sure you spend some time strengthening like your wrists and hands and your ankles as well. Because gymnasts are usually pretty flexible, huh? So you guys do a lot of pounding on your bodies, like hours and hours of pounding on your bodies, right? So make sure you eat enough. Because when you burn all those calories, you need to make sure you have food. A lot of us have to worry that we're eating too much. Gymnasts and young athletes usually aren't eating enough.
Do you have any recommendations on eating enough?
Make sure you have 3 meals a day and snacks in between.
Protein, carbs?
A good mixture. There's now a plate instead of the food pyramid, if you guys have seen it. And it's like mostly vegetables and fruits and then...
Plenty of milk?
Huh? Milk? Oh yeah, milk is good for you. I'm a big milk fan. You know, all the chocolate milk commercials of like after... So the whole idea is that after you work out, the first 30 minutes after you work out is like the ideal time to replenish your body's nutrients because your body absorbs it better. So that's what the chocolate milk ads are all about. Who likes chocolate milk? My son drinks it every morning. My daughter, we haven't let her have it yet. She's just 1, but yeah. So
Anything else you want to?
I was going to touch on rotator cuff injuries because those are real common, and I was going to tell you. So, but by the time we are 50 years old, if we MRI'd everybody's shoulders, 50% of people would have damage to their rotator cuff. So people get very hung up on these rotator cuff tears, not realizing that like literally half the population or more has rotator cuff tears. It's just that if they're not terrible, then most people go on and live with them for most of their lives and may never even know that they're there. If they become symptomatic or get bad or are like a complete rotator cuff tear, then we're talking about needing to do other things for them. But most of the time, it's just about strengthening your shoulder and, avoiding some of the activities like repetitive overhead lifting and stuff like that, that we can do to avoid aggravating it. So, yeah, because rotator cuff surgery is kind of a big deal. It takes about 6 months to a year to recover from. So part of what I do with people is try to see if we can get it so that they're livable, depending on how bad the tear is, and see if we can calm it down and have them live their lives without having to have lots of surgeries.
So it seems as though you're saying it's a permanent scar?
Huh?
It's a permanent scar if it does happen?
Rotator cuff surgery takes about 6 to 12 months to recover from. So I try to help people who have maybe some partial rotator cuff tears, hopefully not have to have surgery, help the shoulder calm down, and so people can go on with their lives without having to take a year out of their lives to really recover from a big surgery. Mm-hmm. That was one other thing that's really common that I just wanted to touch on.
Thank you.
Thank you.
Oh no, I mean, I also do concussions. So my sports medicine, we're the ones who really treat concussions. So I do that with athletes a lot. And so we're people in my profession are the ones that are on the cutting edge of like all these recommendations, and you've seen it all over the news with the NFL players and everything else. Mm-hmm. So I treat concussions.
How are you doing that? Just a brief.
How do we treat concussions? I mean, I work a lot with the athletic trainers in the schools that I work with, but concussions, just very briefly, are an insult to the brain. They're considered a mild traumatic brain injury. You don't look any different when you get a concussion. You look the same, but your brain's not working properly. So if you don't see it on any scans that we do conventionally, and you don't need to, the old adage was, get them home, put them in a dark room, and wake them up every 2 hours. Yes, they can rest, or yes, you can rest after you get a concussion, especially if you have a lot of symptoms. But very briefly, it's a very brief period of rest followed by coordinated light activities, and then very slowly getting back into your daily life. And then last but not least is getting back into sports activities. Okay.
So I had a fall. Is that something I could have and not know it? I hit my head.
Yeah, so you would probably feel very different, like you would feel dizzy or have constant headaches or difficulties with your vision, or things that would be ongoing after that were different than they were before. I mean, there are a lot of different symptoms that concussions can have, but chances are you would know it if you had a concussion.
So concussion is not permanent. I mean,
Typically, no. Typically, people recover from them. Sometimes if people have had multiple concussions, or if they have very severe concussions, or if they've had multiple insults to their brain, you can get chronic concussion type symptoms.
I thought I heard some of the people in NFL that suffer.
It's called CTE.
CTE,
That's what they're talking about. So that is actually separate from a concussion. It's something that occurs years later, typically 10 to 20 years after you finish said sport, or, whatnot. Football in this case was the only sport that's really been proven to have this. But yes, it's about 10 to 20 years later. You have not really had significant symptoms in between, but then you start presenting with more concussion symptoms. Typically, people will present with depression, severe anxiety, suicidal tendencies, and things like that. That several players have completed suicides and things like that, unfortunately. And so we've actually found on autopsy, and a lot of these players have now donated their brains and their bodies to science. And we've found that there are actually changes in their brains similar to brains with dementia, but at a much, much, much younger age than what we would typically expect it. And it's called CTE, chronic traumatic encephalopathy. We think that that was what Muhammad Ali had, we think, too.
Parkinson's.
Well, he had Parkinson's, but we think that it may not have just been Parkinson's.
His head was beat up.
Right, so boxing is another sport.
My father loved watching.
I'm not saying it's not entertaining.
Okay. Any other questions for Dr.
So, and with concussions, is it when you hit your head, you should black out, or that's just an extreme case? Or
No.
can you have a concussion by just hitting your head and just get right up and keep going?
Well, you can, but you typically have symptoms if you have a concussion. So if you're not having any symptoms, then typically that's not a normal concussion. So, yeah, but you do not have to black out to have a concussion. In fact, less than 10% of concussions are associated with passing out or blackouts. So yeah, I mean, it's not super common. And we don't know, we used to grade concussions 1, 2, 3, 4, 5. We don't do that anymore because you actually can't really tell when someone first has a concussion how bad it's going to be. We just have to treat them on an individual basis. It typically takes anywhere from about 14 to 21 days for a full recovery, but people aren't always out of sports that long. It just depends on how they do. Protocols for treatment. So yes, I mean, I'm happy to take any more questions, but also I brought you guys some little stuff so you know how to get in touch with me or my colleagues, or also just some fun like pens and hand sanitizers and stuff that we have if you guys would like anything.
Thank you.
So thank you guys for letting me talk with you. Some faces I recognize. And those of you, thank you. Those of you parents and kiddos out there, I appreciate you coming out.
You can get a picture of this. For those of you who came in a little late, Laura and I go back years.
Gotta be like 20
some, and she was a soccer player at Williamsburg, and also I performed her wedding.
All right.
For her. So
Okay.
we always stop at her parents for pre-game
We
and
did.
afterwards, and it was always good. Yeah. For some reason or other, they always had everybody over the house. Nice and close.
They still live in the house.
Still.
Yeah, they're still there.
So
It was
I'd like to present to you.
Oh, you guys are so sweet. You didn't have to do that. Thank you. That looks delicious. My kids love strawberries. They are now almost 5 and 1. So thank you. Thank you guys so much. That was very thoughtful of you.
No other questions? But now we're going to search over to the we'll take a collection. These things are needed if you want to pass it.
Sure. I mean, yeah. Anybody?
Okay.
Yeah, come.
Awesome.
Me? People want some. I have different things. I have pens and chapsticks. You want to take some of those? There you go. You guys can pass these around. You guys want some? They're actually pretty good pens. I use them every day. Yeah, chapstick. People want them. And this is just my information and my card. If you guys, here, I can split it into a couple. There you go. If you guys want either or, Yep, there you go. I love the hair. She's got so much hair. Hey, how are you? It's been a while. Where do I live?
I have an offer of prayer, Lord. We thank you for this day. We thank you for the health and strength that you give us each and every day. We thank you, Lord, for allowing the doctor to come by and share information. We thank you, Lord, for the offering which has been paid, as you bless it as you see fit. As you remember us, Lord, we plan to depart from this place, to go into our homes, and come back another time. Your blessing as in Jesus' name. Amen. Do you want to thank the Lord for another day? Thank the Lord for health and strength. Had 2 good days. Even went out and worked a little bit today. Came time when I told him, I said, look, I've been down here too long, I need to go. So he thanked me for coming, thank you for helping him out. And I was glad I was able to do it, and I felt as good. But didn't have no chemo this week. Somehow they put it off. They told me be prepared for next week to have chemo. Okay. Whatever you want to do. So thank the Lord for the health and strength that He's given you. Thank the Lord for all things. Turn you back over to Him.
Truly want to thank God indeed for all things, great and small, and for the power of God which is under salvation. For all that believe, thank God for blessing us to be enlightened once again by Dr. Lara. Give her another round of applause. Thank you. So we have completed another 5th Friday, and we've been getting some good speakers in here and learning how to take care of the body. I can feed you with the spiritual food, but there are times when you need to hear from the specialty on what to eat, what not to eat, what to do, how to exercise, so forth and so on. So we thank God for instituting Health Night. Every 5th Friday we do that. So we thank God for that. And thank you again for coming by. Next service, Sunday school, 10 o'clock. 10 o'clock, Sunday school. Amen. Anything else? Glad to see Deacon Paul back out again. Amen. And his little granddaughter there. Is she the gymnast? Is that the gymnast? She's the gymnast. Okay, so you might talk to Dr. Lara. She might be able to have some advice for you on what you got to do to be careful, as you can hurt yourself. No doubt. You can hurt yourself. All right. Remember Deacon Keith on the road, Ella Marcus on the road, and Brother Brian is on the road. And remember the babe in the womb?
Yes, thank you.
And the mother that is carrying the babe in the womb?
Yes, thank you.
Amen. Where's Sister Brooke? I didn't see her.
Brooke, right
She
there.
right there? Okay. All right. You're mighty quiet this evening. Nothing else? Let's look to stand, look to the Lord, and be dismissed. Let us all repeat, may the Lord watch between me and thee. When we are absent, one from the other, together can we all say, Amen. Amen.